Well, you know, October is Breast Cancer Awareness Month, so we wanted to talk to a specialist regarding breast cancer. Dr. John Bailey with South Mississippi Surgeons. Good to see you again.
Thank
How have
you.
you
Good
been?
to see you. I've been doing great. And yourself?
I'm doing very, very well. Thank you. Now, you're with the South Mississippi Breast Center, and as part of the Singing River Health System. Give us a little background about yourself first, if you would, please.
So I'm a general surgeon. I went to school and trained at University of Alabama, Birmingham. I've been here now a little over 21 years. We do all facets of general surgery in our practice in this group, including bariatric surgery. I specialize in breast surgery and have been doing so for the last several years. I have some special training and certification in breast stereotactic procedures and breast ultrasound procedures that we are able to do here in the office.
Now, the statistics, unfortunately, are pretty big about the number of women that are diagnosed on a daily basis with breast cancer, you know, across the country.
Yes, it is unfortunately very common cancer. Roughly 1 in 7, 1 in 8 women are going to develop breast cancer in their lifetime. And so just about everybody knows somebody or is related to somebody who has or will get breast cancer.
Now, if you know, is it something that's hereditary? I mean, does it run in the family, or can just someone, you know?
It's a good question. It can be hereditary. There are some genetic mutations that put patients at very high risk, such as Angelina Jolie had a few years ago and had her breast removed prior to developing cancer so she would not get cancer. There are other less strong family relations that happen as well, and then there are the occasional, or there are more patients that have just random bad outcome or bad occurrence. It's not necessarily hereditary. And so for the hereditary patients, we offer genetic screening for those patients here in the office, whether it be the patient with breast cancer or a family member of a patient with breast cancer. If they fit the criteria, we can draw those labs here. The lab work is done through the Myriad Genetics company out in Salt Lake City, and usually takes about 10 to 14 days to get results back.
Now, with you were talking about Angelina Jolie. She, you know, before she could develop it, if you find someone is genetically inclined to get breast cancer, do you recommend them to go ahead and have mastectomies?
In some cases, yes. We certainly want to talk with the patient about it. There is a varying degree of how likely that person is to develop cancer, and we try and factor that into the decision. And then obviously the patient's desires and wants are the overriding concern of all of it. And so some women will choose to just be watched very closely, and if something appears to be suspicious for breast cancer, get a biopsy at that point. Other women don't want to worry about it, and they will choose to get bilateral mastectomies at an early age.
Now, as far as the, you know, I guess it depends on how advanced it is, depending on whether, if they can simply get it before it gets in the lymph nodes.
Correct.
And just have the simple mastectomies.
Correct, or lumpectomy, either one. So we don't always have to remove the breast. As a matter of fact, most women don't have to have the breast removed with their surgery. Some choose to do so, some need it based on the size of their tumor or location.
Right.
So that's part of the discussion we have with the patient that's diagnosed with breast cancer is, you know, what's the best option for you? And the good news is we have multiple surgical options, and we're able to.
Well, technology has come so far, you know, in the past decade.
Yes, it's surgery has made leaps and bounds in the last few years. Even bigger changes in radiation and medical oncology. And so when we discuss with the patients lumpectomy or mastectomy, we can talk about reconstruction or no reconstruction with mastectomy, and that can be done in various ways, and at same surgery or later dates, depending on what the patient chooses.
And I know someone that had a mastectomy, and it was, as soon as the surgeon walked out, the plastic surgeon walked in and started the reconstruction right there.
That's correct, and that, you know, for that patient was the right choice. And for others, that it might be a delayed reconstruction is a better idea.
Right.
Part of what we do in our practice, and part of what I do as a surgeon, is to coordinate all of that care. So when the patient comes to us with a breast abnormality or a breast mass found either on screening by her primary care physician or her gynecologist, or found on mammography via radiology, we do a biopsy if necessary. If it turns out to be a cancer, then I help coordinate getting that patient to surgery, to plastic surgery if need be, medical oncology to see if they need chemotherapy or anti-hormone therapy, radiation oncology if they need to have radiation therapy. And in the midst of all of that, through the Cancer Center at Singing River, we typically will have a tumor conference once a week where we discuss these patients and we have radiology and pathology there as well to help add their information about the other studies that are done through the hospital, along with radiation oncology, medical oncology, and me as surgery. And then we're able to put together an individualized plan for each patient.
And of course, as you said, each patient is going to be different as far as if they need to add chemotherapy, radiation therapy to, I guess, any advancement in the cancer cells that perhaps have gotten into the lymph nodes.
That is correct. And of course, the beauty of that also is that sometimes we're able to come back and tell the patient, you don't need anything more. You've had all that you need with surgery. Adding more is not going to make you any better. And so, obviously that's the best patient of all, and they're the happiest. They don't need anything more, they're done.
Now, you were talking about finding out early. At one point, should a woman start doing? I know they always talk about doing self-breast exams in the shower. They're very soapy. Your hands can feel it a lot better, or a lot easier.
That's a great question, and there is no great answer to that. There are lots and lots of opinions on when to start. I recommend most women start in their 30s. Breast cancer in the 20s is very uncommon. It's not unheard of. So if a woman finds a lump at any age, it warrants being looked at more closely and evaluated. But usually I recommend in the 30s. That's when breast cancer starts to become a little more common. It's still not common at that age. It's much more common in 50s, 60s, 70s age range. But we see it enough in the 30s and 40s that it's worth going ahead and start doing. I recommend mammography at age 35 still. There is controversy about that as well.
Is it harder to find if a woman has implants?
It is a bit more difficult. It's not impossible, but it requires, for radiology, they have to do special views with mammography to get the implant out of the way and be able to see all of the breast tissue.
Gotcha. Okay.
And so, but the radiologists that we have and the radiology techs that do mammography are very well trained in that. And so we get good pictures.
Well, I've met some of the doctors and the radiologists and specialists with Singing River Health System in the radiation sector and the chemo and everything. And it's just, as you said, a great group of physicians and technicians that are involved in this.
That's correct. This is a multi-player approach. It's a big team, and it requires coordination of all of that care. And again, that's part of what we offer here is coordinating all of that care so the patients get to the right people at the right point in their care plan.
All right, Dr. Bailey, it's good to see you as
Yes,
always.
sir.
Thank you very much.
Thank you very much.
If you need some more information, of course, if you have any questions, go to your general physician first, your general practitioner.
Correct.
And get them definitely to recommend you seeing a regular surgeon like this if you need to do so, and catch it at a very early stage.